Greeting, my name is Natasha Janae, and I am a doctorate candidate at Albizu University. I am a native of Port-au-Prince, Haiti, and I was raised in South Florida. And today's presentation will be talking about the psychosocial stressors and mental health difficulties in Ayiti and in Diaspora that the Haitian community are facing. And so before we get started, a quick presentation overview. So we'll be talking about the historical perspective of the mental health system in Ayiti, cultural health beliefs, the chronic stressors, and what is being done in country in Ayiti to help alleviate some of those stressors. So before we get started, I do want to point out that you will notice that I use the term Ayiti versus Haiti in my presentation. And this is because I am intentionally using the indigenous name of the country. So the name was given by the Tainos, Ayiti meaning mountainous land. And so that's the term I will be using. I will be using the country's original name throughout my presentation, okay? All right, so let's get started. Let's jump right on in. So the first counseling practice in Ayiti began in the late 1980s with the launch of a major AIDS prevention campaign that included face-to-face contact with at-risk populations. So counseling services were a major component of this response to the increased rate of HIV/AIDS and sexually transmitted infections. So education and counseling were seen as the only available preventative measures at the time. However, with respect to mental health facilities, Ayiti inherited the American model of mental health hospitals in the early first half of the 20th century. So opening Hospital Berde, which is the largest public psychiatric facility, which holds about 120 beds, and is housed in the old abandoned military camp in Kwadebuke near Port-au-Prince. In addition, the Center Psychiatric Mas Decline is a psychiatric care and a psychological service facility, which has a capacity of 20 beds, and it is an outpatient clinic that's attached to the Hospital of the State of University of Haiti, which is in the heart of the capital. So in addition to those two facilities, there are 3 other private centers with 100 beds in total. And the psychological unit in those 2 private hospitals in Port-au-Prince offer psychological and psychiatric service, but only to the more affluent members of the community. And in other regions of Haiti, there are 4 units that offer psychological care in public hospitals in the southern Lakai, Gonaïve, Atibonite, Cap, Haïtien, and in Joliette area. And this is very important to note that these facilities provide the basic service, the very minimum service, and it is very limited on staff. So staff can consist of 1 or 2 junior psychologists accompanied by 2 or 3 nurses. So for a population, for a country's population of nearly 11 million people, as you can see, they're definitely understaffed. So some of the cultural health beliefs that may apply to the Haitian population would be that mental health problems are often seen as a supernatural force. Mental illness, problems in daily functioning, academic underachievement may be seen as a consequence of a spell, a hex, or a curse transmitted by a jealous person. So people often rely on their inner spiritual or religious strength to deal with their problems. Mental illness, mentally ill people may be seen as victims of powerful forces beyond their control and thus receive support from the community. But most people kind of steer away from actually going to a therapist or a psychologist to receive these services because of the stigmas that are usually associated with mental health. But regardless of the type of mental illness or illness in general, family members are usually the first to be consulted regarding treatment and advice. So Haitian may not necessarily accept psychotherapy because solving personal problems is usually viewed as a family or religious matter. And then in some cases, people may go to a voodoo priest, spiritual leaders, before consulting with a therapist. So that's why it's really important that if a person does come out of their shell and pretty much seek psychological services, it's really important for that clinician to develop a culturally congruent treatment, integration of indigenous health beliefs when conducting any type of therapy with anybody in the Haitian population, because these are truly, truly important aspects to consider. And health beliefs may be inquired through questions, right? So questions such as, how do you think these symptoms come about? What meaning do you make of them? And why do you think these things are happening to you? These type of questions will kind of help you with the rapport building and getting the client more comfortable with explaining what exactly they're feeling at the time. And so some chronic stressors that kind of been going on for, I guess, the past few decades have been ongoing chronic stressors, natural disasters like the earthquakes and the hurricanes and the floods. So since 2010, Haiti have already been impacted by 2 major earthquakes that has killed hundreds of thousands of people. And then you had Hurricane Matthews in the mix and some flood situation that have prolonged the stress even more. Haiti have been in extreme poverty for quite some time now, with the average person making under about $2.50. The political unrest, which is a situation where political people are protesting through demonstrations and using violent acts to try to get their message across. Coup, the illegal seizure of power of the government, of the Haitian government. The president assassination was a major hit, was a chronic stress, part of add-ons to chronic stressor, because while all type of murders can impact a society significantly, assassination, especially a political assassination of a public figure, such as the president of a country, can be psychologically unsettling and significantly impact the society. And this is due to the fact that such killing often have different motivation and consequences. But needless to say that when a head of state is killed, members of the nation will undoubtedly be impacted by such horrific situation, right? So gender-based violence, and I would say with everything that's going on with the country, the political unrest, the riots, the kidnapping, all that has caused people to stay indoors more, and COVID-19 as well, which would lead some people to have to stay in the house with their abusers more, which has so the gender bias violence rate has also went up because of that situation. And so a lot of kidnapping has been going on in the country as well, which is causing people to feel unsafe. Kids are unable to go to schools. Parents are unable to, go out and work and bring income to the family. So those are causing chronic stresses too, because that's causing financial distress. And lastly, forced displacement. Many individuals and families have been seeking safety by leaving their homes, leaving their culture, their community, everything they know, because pretty much everything I have mentioned here, these are things that have been ongoing in the country, and the people are feeling that the only place they can find some refuge is by leaving everything that they know. And so with all these chronic stressors, you would think that these people will be going through some major PTSD. The thing is, so there is no P in PTSD when it comes to Haiti and the chronic stressors, because it's not post. This has been going on for decades. It's been going on for a while, and it's kind of hard to to say post-traumatic stress when the situation is ongoing. All right, so with all that's going on in the country, because that is a long list for one country to be going through, right? Who are the mental health providers? So for that, a population of nearly 11 million people, there's only 23 psychiatrists and about 90 psychiatric nurses, 124 psychologists, nearly 50 social workers, 30 psychiatric nurses, 20 psychiatric psychiatrists who are serving the mental health needs of Haiti and its people right now. So the numbers may have increased slightly, but not much, and nowhere near enough for 11 million people. So therefore, we are in dire need of more people to go into this field and to provide service to the population. And so the current mental status in Ayiti right now, right? So many of the health professionals in Ayiti are Haitians who have completed their studies at the secondary, like specialist or master's or third level doctorate degree. And most of the people, well, the people who receive these degrees receive them in other countries such as US, Canada, Mexico, Europe, France, Belgium, Switzerland, and so on. Because in fact, in IET, within IET, the bachelor's degree is the highest degree awarded to in psychology. So upon completion of a bachelor's degree, individuals are able to complete a portfolio that is submitted for licensure as a psychologist in IET. All right, so now that we know who's providing the services, what kind of trainings that they're getting, who is able to have access to these mental health services. So nearly half of the population lack access to formal healthcare services, right? So specifically, access to mental health service is even lower. And across the healthcare facilities, only 30% of public and local services are in the urban areas. So nearly 3/4 of the health services in rural areas are provided by NGOs, and they're usually primary for healthcare. So not really for mental health care, but the ones in the rural areas gonna be more so for primary healthcare. So for a population of nearly 11 million people, IAT have the lowest rate of professional psychosocial support in the Caribbean and Latin America, and one of the lowest in the world. And in reference to trauma services, so Unit de Research de Acción Médica Legal is a psychotrauma center established February 2010, and it was established by Haitian NGO. The Center of Research and Psychosocial Intervention, established in March 2010, were the only two spaces created to serve the many individuals who are likely to experience these trauma-induced reactions from all the things, the stressors I mentioned earlier. However, now the Haitian Association of Psychology has now also started assisting with that through their helpline that is available for the whole Haitian population across the island. So it looked towards the future, right? So the mobilization of psychologists in Haiti since the 2010 earthquake have increased significantly, right? So it's noteworthy to highlight the progress that we're going in the right direction in terms of nationally mental health policies in IET. No less than 7 meetings with average of attendance of 30 psychologists were held from March to December 2010 to plan an implication of formulating the Haitian Association of Psychology. And I am pleased to say, so since 2010, the Haitian Association of Psychology has been in the forefront, and they have been front and center during the 2021 earthquake and Hurricane Matthews and everything else that's been going on in the country, providing psychological services. So such as having the helpline that they have, the gender-based violence emergency response, and they have implemented quite a few intervention and prevention programs throughout the country. And Ayiti Santé Mentale continues also to collaborate with local organizations such as the Haitian Association of Psychology and Hope on the String to provide services, psychological first aid, and basic mental health training. Ayiti Santé Mentale have been traveling to the country for the past 10 years, providing these services in the Akaye, Semak, Moli, Antigua area, and basically providing training on the common signs and symptoms of mental health and mental illnesses. So take home messages, right? So it is important to understand that culturally tailored interventions are a must. To deal with this population, you definitely have to take in consideration the cultural aspect of the mental illness. And this is critical to expand on the talent of the local individuals to conduct the work. That's why it's really important that, you know, the training go to the people that's in the country, on the ground, doing the work, because they can relate more. And so tapping into the talent is really important. Community engagement and involvement is key, because Haiti is a collective state, and country, and they look to each other more so. So community engagement and involvement community in your treatment will be very beneficial. And it's really important to think about the capacity building when it comes to the changes that we want in the country. So that concludes my presentation. Again, my name is Natasha Janak, and and the screen has stopped sharing. Any questions? I am open to questions now.